Hello Melati villagers, how are you? I hope we are all in good health. Let me first introduce myself. My name is Chelsea. I am a nursing student from Stika Santa Elisabeth Semarang. According to our time contract, this time we will have our health education program. In this webinar, we will learn about how to prevent the HIV/AIDS transmission in the society. Although we learn it virtually, I hope we all can understand and take action to prevent the HIV/AIDS transmission. Are you ready for it to begin? Take a comfortable seat along the discussion. Before I start the material, I would like to ask, what do you all know about HIV/AIDS? Have you heard about it before? Wow, thank you for your answers. Some of you might have heard about it before, but this time we will learn about the definitions, signs and symptoms, transmission, and the prevention of HIV/AIDS. Without further ado, let's begin the material. So, what is the definition of HIV and AIDS? HIV, or human immunodeficiency virus, is the virus that damages your cells in the immune system, while AIDS, or acquired immunodeficiency syndrome, is the syndrome of life-threatening illnesses or infections that happen when you got HIV. The largest HIV-infected population in the world is Africa, followed by Southeast Asia, and then America. While in Indonesia, HIV reached its peak in 2019. The highest number of HIV cases are in East Java, DKI Jakarta, West Java, Central Java, and Papua. And the province with the highest number of AIDS is in Central Java. While AIDS cannot be transmitted from one person to another, the HIV can. Currently, there is no effective cure for it. But HIV can be controlled with an early diagnosis and effective treatment. When people with HIV don't get treatment, they will go through 3 stages. First stage is acute HIV infection. Second stage is chronic HIV infection. Stage 3 is acquired immunodeficiency syndrome. The symptoms of HIV vary depending on the stage of infection, like fever, rash, chills, night sweat, muscle ache, sore throat, fatigue, swollen lymph nodes, and mouth. Having these symptoms doesn't always mean people have HIV, because these symptoms also happen because of other illnesses. See a healthcare provider to get tested for HIV. Now, let's talk about the transmission. HIV can be transmitted through exchange of body fluid from the infected people, such as blood, breast milk, semen, and vaginal secretion. Ways of getting HIV include: first, having anal sex; second, having vaginal sex with someone who has HIV without using protection; third, from the mother to her baby; and fourth, from sharing needles, syringe, and other drug injection equipment with someone who has HIV. There is little risk of getting HIV from oral sex, workplace such as hospital, medical care such as from blood transfusion, pre-chewed food from the caregiver to an infant, biting and open mouth kissing as long as there is no skin that is broken, female to female sex, and tattoos and body piercing. HIV is not transmitted through insects, saliva, tears or sweat, hugging, shaking hands, sharing toilets, sharing dishes, close mouth kissing, and also other sexual activities that doesn't involve the exchange of body fluid like touching. Now, we will talk about how to prevent the transmission of HIV/AIDS. The Ministry of Health of Republic Indonesia have the prevention theory known as Teori Pencegahan A, B, C, D, E. A is for abstinence. Abstinence means having no sex. This is 100% effective way of not getting HIV through sex. B is for be faithful. Being faithful means to stay loyal to one sexual partners or not changing sexual partners. C for condom. Use condom every time you have sex. It prevents the exchange of semen and vaginal fluids. D. Do not use drugs. When you are high on drugs, you are more likely to engage in risky sexual behaviors. You might also share needles, syringe, and other drugs injection equipment. E for education. You must look for the right information about HIV, how it is transmitted, its prevention, and treatment. By then, you can prevent the mother-to-child transmission, also encourage those who are in HIV diagnosed, and also to tell them to stay and get the treatment. Also, we all can live longer and healthier. Well, I have finished presenting my presentation. Does anybody have a question? Not yet? Okay. Let me evaluate our understanding on today's discussion. Can you explain the definition of HIV/AIDS? Excellent. Now, next question. Can you explain the signs and symptoms of HIV/AIDS? We have 9 of it. Can you recall some of them? Wow, you remembered. Next question. Can you explain the transmission of HIV/AIDS? We have 4 ways. Can you explain it? Nice. Last question. Can you explain the prevention of HIV/AIDS transmission? Remember the teori upaya pencegahan A, B, C, D, E? Can you explain about it? Wow, good job everybody! Alright, we've come to the end of today's health education program. And according to my evaluation, all of you have understand about today's material. I hope all of us can take action to prevent the HIV/AIDS transmission. If you have further questions, don't be afraid to contact me. I think that's all for today. Thanks for having me. See you on another health education program. Bye!